Certainly there are a lot of chronic conditions, such as different cancers, for example, and there's going to be a lot of stress, a lot of anxiety, certainly around the point of diagnosis, the worry, the concern, right the way through treatment. So that could create an insomnia framework, which is going to prevent you from sleeping as much as you would like, when you would like. One of the other issues that we get is actually a lot of treatments. And again, within the framework of cancer, medications that we use in this framework, as well as radiotherapy, chemotherapy, they tend to impact on the circadian rhythm. And actually, what you can see is it dampens it somewhat. And this is why sleep actually is quite important during any form of chronic condition, right the way from diagnosis through to treatment. If we can help manage the sleep, we can make the best of a challenging situation. Dealing with the anxiety, the worry, the uncertainty, the psychological aspects and the emotional aspects associated with the illness, but also the physical side of it as well. A lot of those medications will impact on those 6 hormones. Remember we talked about those, or GABA. And so this is when we really want to talk about making sure we've got really good routines, making sure that we've got everything out of the bedroom that is going to keep us wired at night, putting the day to bed before we go to bed. All of those things, believe it or not, CBTI works beautifully well within the context of insomnia in cancer, pain, hearing loss, alcohol addiction, a whole host of issues. And it really is about stabilizing the internal mechanisms and focusing on alleviating the worry and the stress that might bleed into the night.